Hi, my name is Courtney Wilson, and I will be discussing my thesis that was on evaluating the compounding effects of weight loss and weight gain in choosing to exercise. Obesity is an American epidemic. It has been a public concern, but more recently due to the significant increase in the amount of population that obesity affects. More than 1/3 of the population is obese. Obesity is not a single problem with one physical ailment. There are numerous issues that come along with it. Obesity-related conditions include type 2 diabetes, heart disease, stroke, some types of cancer, as well as preventable deaths. It has been found that obese men are more likely to develop cancer of the colon, rectum, and prostate than men that are not obese. Obese women are more likely to develop cancer of the breast, gallbladder, uterus, and cervix. Obesity is something that can have lifelong effects and impacts. The rate for obesity within kids is 1 in 6 kids, which makes up 17% of the adolescent population. Obesity recently has been linked as a prevalent factor in the development of new cases of diabetes in the United States. It is estimated that over 48 million people in the U.S. will have diabetes by 2050. There are also social and psychological effects that come along with obesity. It's not the only cause for severe physical ailments, but it also linked to other effects such as depression, social anxiety, disparagement of body image, and negative emotional reactions to dieting. It is considered to be socially toxic, affecting both how people are treated as well as how people feel about themselves. The view that comes with obesity is often seen as a choice or a lack of discipline. Viewers believe people with obesity use food as a way of reducing anxiety, a form of guilt, or even gratifying an oral fixation. Exercise is a temporarily extended solution. Exercise is a solution. Exercise is a temporarily as an extended solution. Exercising only a couple of times will not be the solution, nor will have a significant impact on the obesity rate or disease that go along with it. Small weight loss can lead to multiple health benefits, but is often unsatisfying to many obese people that desire a larger weight loss. Studies have been conducted that provide research showing that regular physical activity improves weight management for more than 10 years after treatment in obese children. Exercise as a temporarily extended solution prolongs life and reduces the physical and financial costs of obesity. According to Buchner, every adult should accumulate 30 minutes or more of physical activity on most, if not all, days of the week. New control trial evidence has accumulated in the area of type 2 diabetes that moderate physical activity combined with weight loss and a balanced diet can confer a 50 to 60% reduction in risk of developing diabetes among those that are already among high risk. Behavioral economics and choice is a compounding commodity. Behavior economics and choice is a compounding behavior. History of behavior shows that people often behave paradoxically with the thought process of they do things later that they wish they had not done, or they fail to do things that they wish they had done. It has been shown that interventions that focus relatively less attention on increasing health and more attention on increasing access to the immediate valuable reinforcer activity potentially provide the most powerful and lasting interventions. Discounting and delayed reinforcers refers to the observation that the value of the delayed reinforcer is discounted, which means reduced in value or considered to be worthless, compared to the value of an immediate reinforcer. The overall view is that the allocation towards behaviors with health consequences is an intemporal choice between smaller sooner rewards and larger later rewards, and smaller sooner costs and larger later costs. Not many studies have been conducted on behavior of health and compounding commodities such as exercise. Numerous studies have included monetary value, cost effort, or behavioral response with other reinforcement. Factors that may influence choosing to exercise. There are numerous social and demographic components that play a key role in choosing to exercise. Parents that are obese and have less physical activity generally have children that are obese or will become obese within a minimum amount of physical activity. Also, children of obese parents have a substantially higher risk of adult obesity than children of lean parents. From a young age, children develop routines and sequential processes that will stay with them the rest of their life. According to a study conducted by Grillo, Wifley, Brownlee, and Roden, Subjects with early onset obesity reported greater body dissatisfaction than did subjects with adult onset obesity. These findings suggest that being teased about weight or size while growing up might represent a risk factor for the development of negative body image recovery. Factors that may keep people from choosing to exercise could be certain medications that make people gain weight and cause influence to not exercise as the person, as the consequence would not be reinforcing enough or as an immediate response. A solution for limitations that could occur are related within the choice paradigm. According to Chen and Risen from a study in 2010, people reevaluate their choice more positively and the rejected choice more negatively, which in turn could decrease the desire to exercise regularly. Now we'll go over the methods. The participants were 31 males and females that ranged from 21 years old to 58 years old. The female population of participants made up 81.8%. The male participants made up the other 18%. The annual income ranged from $10,000 to $200,000 annually. The average income was $69,000 a year. The different ethnicities that took part in the study were Asian at 3%, biracial at 3%, Hispanic or Latino 6.1%, and Caucasian at 87.9%. The body mass index was calculated by the information that was collected in the demographics portion of the questionnaire. The average BMI across participants was 23.89, which fell in the average range. The body mass index broken down per section was 11 overweight participants, which made up 35%. 61% of the participants were categorized as average or normal, and the remaining participants made up 4%. Materials. After permission was given, 2 discounting health questionnaires were sent out. The statement at the top of both surveys read, "This survey will evaluate weight loss and gain as a motivation to exercise. Please examine each of the choices below and select either option A or option B for every question. Assume that the intensity of all exercise options is the same, where only the length of the exercise session can vary. For example, a 50-minute exercise session is twice as difficult as a 25-minute session." Each survey consisted of 80 questions that were similar in format. Sample question for the gain condition says, would you rather not exercise for 1 day and gain, insert ascending amount of pounds, A, or choose exercise for an hour 1 day and gain 0 pounds, B? Or a sample question from the loss condition. Would you rather exercise for 1 hour 1 day and lose X amount of pounds, A, or choose not to exercise for Y day and lose 0 pounds, A or B? Data analysis. Statistical and visual analyses were conducted at the group and participant level. The switch point, defined as the last choice selected with an imposed consequence before the selection of choice with no imposed consequence, were documented from each delay, X. For example, it is the value between the last value where the participant chose to either exercise or gain a specific amount of weight. The value was determined by finding the difference between where the choices occurred. The formula was PV equals SW plus X divided by 2. X represents the maximum amount of pounds that the participant could have chosen during each block of time. SW is a switch point. For survey 1, the larger the AUC values, the healthier the exercise choice was. The smaller the AUC values, the more unhealthy the choice was. For survey 2, the smaller the AUC values, the healthier the participant's choice was. Results. The results for figure 1 displays a scatter plot that shows the mean proportional switch values across proportional days. The mean proportional switch values were calculated at each block of 1, 5, 10, 25, 100, 300, and 600 days. Both the gain and loss conditions initially peaked, but the loss condition immediately decreased after day 1, whereas the gain condition continued to peak until day 100. The data showed that the greatest proportional switch value occurred at the 100-day delay in the loss condition at 0.2. Overall, the lowest proportional switch values occurred in the gain condition and the highest proportional switch values occurred in the lose condition. The significant peak that occurred at the 100-day delay shows that the participants chose the option to gain rather than exercise until the 100th day. Then the participants opted to start exercising to not gain any more weight. In front of you is figure 1, comparing mean switch points for both groups. A significant peak occurred with the 100-day delay to lose weight. Participants chose the option to gain weight rather than exercise. After the 100-day delay, majority of the participants opted to exercise rather to gain weight. More about the results. The gain component has shown to increase up to 100 days longer than loss, which shows that the participants are tolerable to gain for only a certain amount of time, but chose to engage in healthy living and exercise as the preferred choice after that. The visual analysis of the data shows that the proportional value of the weight, according to the data, both conditions similarly had the lowest proportional switch point at the 300-day delay with 0.01 and parallelly stayed consistent at 0.01 to the last condition of 600 days. Overall, most participants were more likely to choose to exercise when weight gain or loss was compounded. We are now looking at Figure 2, providing curve fits for both groups. The two-phase exponential decay was used. The two-phase exponential decay was used to provide curve fits for both group and represents the lose weight and avoid weight gain conditions. Figure 3 is a scatter plot of the comparison of AUC values. Figure 3 shows the comparison of AUC values from all the participants. The results show that more participants chose to avoid weight gain later in the condition rather than before. Participants that chose to lose weight chose to engage in exercising immediately. The current study required participants to partake in a health discounting questionnaire that displayed hypothetical sequential discounting scenarios. The responses consisted of losing weight, gaining weight, or not gaining or losing. The temporally compounding variables observed showed that the participants chose to gain weight for up to 100 days. This was indicated by a higher switch point with the AUC values. The data shows that the participants chose to immediately exercise when it came to losing weight, but were tolerant of gaining weight until 100 days, then chose to start exercising. This shows that the compounding variable to lose weight has a more immediate reinforcement than the exercise itself. These results were shown when analyzing the AUC scores for both the gain and loss conditions. These findings indicate that to maintain a healthy lifestyle, the participants will not exercise as a preventative measure to not gain weight, but will engage in exercise behavior as a reactive measure to lose weight, but only after it has been gained through a certain amount of time. Exercise is a temporarily extended solution, as well as sustained weight loss prolongs life and reduces the physical effects that obesity can have. The compounding variables that show to be most reinforcing to the participants is the lose condition that participants were willing to engage in after day 1. These findings are important as the behavioral economics and discounting toward cumulative outcomes with temporally compounding variables are significantly important when analyzing behaviors within health. A little more about the discussion. The study expands and emphasizes previous literature in regard to evaluating the effects of compounding effects of weight loss or weight gain. Previous studies have been conducted using delayed discounting and compounding variables with other subjects, such as monetary delayed discounting tasked between obese and average weight individuals, with Weller, Cook, Evsar, and Cox in 2008. Not many studies have been conducted using discounting in a compounding manner when it comes to a choice of gaining, losing, or neither losing or gaining. According to Simpson and Vulcan, the value of long-term health rewards decreases the value of competing alternatives increases may be occurring in the losing condition for certain individuals, with the competing alternative being the gaining weight condition. A study conducted by Biscoe in 2001 came to a similar conclusion that for the current smokers, delayed cigarettes lost subjective value more rapidly than delayed money. Overall, cigarette smoking, like other forms of drug dependence, is characterized by rapid loss of subjective value for delayed outcomes, particularly for the drug of dependence, Bickel 2001. Although the current study shows the compounding variable increasing immediately and then decreasing, it shows a large shift on preferences of all the participants. Overall, the results of the current study show the compounding effects regarding weight loss and gain. This is important as further investigations could help provide ways to encourage society to be healthier and reduce obesity rates by advising a continuous amount of exercise. Exercising alone could reduce obesity rates and diseases and conditions that are associated with obesity.